In today's society, topics such as plastic surgery have stopped being a taboo, and more people are coming out to discuss about plastic surgery openly without shame, fear, or stigma. We have patients who have undergone plastic surgery who have come out not more than one occasion to share their journey, their recovery, and what the experience has been. And we also have prospective patients who have shown willingness to accept that they will benefit from plastic surgery. However, there's a but. With this explosion of information about plastic surgery, we do have a lot of misinformation and misconception. Here to demystify some of this misconception and have truth about plastic surgery, I am Dr. Martin Ajojo. I'm a consultant, plastic, reconstructive, and aesthetic surgeon at AJ Plastic Surgery Center, the home of plastic surgery. Let us call this session Plastic Surgery 101, and this week I'm going to react on what were the sentiments about when someone asks you what plastic surgery is. Upfront, I'd just like to say I was very impressed with the knowledge about plastic surgery, and at least most of the people who are interviewed seems to know what plastic surgery entails in a nutshell. And if I'm to define what plastic surgery is the process of reconstructing either a defect that is inborn, what we call congenital, someone has been born with, or acquired. Acquired, it means it has come your way either by trauma, accident, or burn, or even infection or some diseases. That is the reconstructive part of plastic surgery. And then there is now what we call the cosmetic or aesthetic part of plastic surgery, where we try to change form, making it look better, more appealing. And plastic surgery is governed by principle of form, function, and beauty, aesthetic. So when you have a defect, you want to replace like with like. You want to replace that defect with a tissue that looks like that, so the form, and then function. So whatever you're replacing, that part of your body that is missing, the defect, must be functional. If it's a fingertip, it must be a tissue that has sensation. If it's an ear, it has to be a tissue that will function or give function that the earlobe would give. Nose, the same. So you sort the form, but the form that you're putting in must be functional. And the last important aspect of the triad is now the beauty. It must look beautiful, because you can replace a defect or a tissue with something like that's fitting, is functional, but is ugly, or it has bad scarring. You not have completely done your reconstructive or your plastic surgery, if I may say. And plastic surgery is one of the disciplines that cuts across the body from head to toe. Just to give an example, we do hair transplant, and then a number of procedures around the face, from the upper eyelid, the lower eyelid surgeries, either to make them look beautiful or to reconstruct. Then the cheek, sometimes we have cheek implants to make them prominent, or we do fillers and Botox just to make the face look beautiful, and to deal with the problem that come with an aging face, the drooling, the drooping, and do a bit of facial rejuvenation with stem cells. And what we like to use is fat-derived stem cells. Moving down to the neck, do neck lift, give a jawline, a smooth jawline, various procedures, one of them being liposuction. Around the trunk, from chest area, prominent thing, one of the common procedures, breast surgery. And breast surgery can either be breast reduction, or excessive large breast come with pain, discomfort. So you have to resize them to have size that are bearable. Another procedure is now the other opposite of it, which is now breast augmentation. For breast augmentation is where you have small breast and you want to add volume. So you either add volume by using fat or artificial, what you call silicone implants. Another big aspect of breast surgery is breast reconstruction, especially after mastectomy, that is removal of breast after having cancer, because cancer treatment is very traumatic. Losing a part of your body is very, comes with stigma, comes with mental disturbance. So you want to reconstruct, you want to restore someone's life in a wholesome. So we do breast reconstruction after mastectomy. Going down for cosmetic, there's a number of procedures around the tummy. One of them, very common, is tummy tuck. What would necessitate tummy tuck is either changes after pregnancy, so that the expansion of the abdomen to accommodate the fetus, the baby, bring changes into this structure, what we call the abdominal wall. And after pregnancy or multiple pregnancy, then you have to repair. And that's, we use tummy tuck techniques to remove it, to repair the muscle that usually separates, and also to remove excess skin and fat. This can be done, commonly done now to achieve good results in combination with liposuction. Within that realm, also we have liposuction without a tuck, and this is just to remove fat from different parts of the trunk, the side rolls, the back, and sometimes we transfer that to cover the hip dips or to enlarge or enhance the butt, what we commonly refer to as the BBL. Going down, there are a number of procedures, both cosmetic and reconstructive, around the genital area. All the way, then the other procedures, the limbs, the legs, and the feet. As you can see, plastic surgery is a whole, head to toe business. I'm going to react to a number of misconceptions and misinformation that is all over about plastic surgery. And I hope by the end of this session, we're going to be more enlightened, and I'll try to answer some of the things that I get and inquiries during my consultations. One of the first misconception is that more often people think that plastic surgery will make you fake or you're using plastic. I think from just the scope of plastic surgery, this is a big lie, because when you're reconstructing a form, reconstructing a defect, or when you're enhancing either a breast, butt, or facial appearance, the principle is to use like for like, meaning you want to make someone as natural as humanly possible. And you don't want to have a fake look. You don't want to have a dull look, in quotes. So you want whatever the outcome that you're going to achieve after plastic surgery is as natural as possible. And no, we don't use plastic. It's just for evolution. Plastic is from the Greek word plastikos, and it's a specialty that involves molding. So you're molding whatever part of your body into what the desired outcome is. And that's why it's called plastic surgery. So the second misconception would be plastic surgery is for the rich or for the elite. And this one I'll share from my experience of people that I've attended to. Majority of clients or patients seeking plastic surgeries are just ordinary Kenyans from all corners of this country and beyond. A number of Africans have come here, and all age groups, all religion, in different careers, from just business people to bankers, teachers, doctors, lawyers. And I've not seen any bias to certain class, if I may say, of people. And it is usually a personal choice. Most of people who come to seek for plastic surgery services is because they want to feel good, they want to look good. And for me, that is a very motivating factor. If the push to have plastic surgery is from you and not from any external forces, then it makes the outcome even better. The third misconception is that plastic surgery is only for women. I know it seems that because most of people come out to discuss their journey are women, and because men are very conservative. However, despite many more women doing plastic surgery procedures than number of men, and I can put it at about 30 to 40% who quietly seek plastic surgery services. And it's a common procedure that we do is man boob reduction, liposuction for men to get rid especially of very stubborn fat around the waistline or the lower tummy. And then we have hair transplant, which is big. And for some reason, we have more and more Kenyans losing their hair. Maybe it's global warming, I don't know. But yeah, we have a number of them seeking hair transplant services. And I've done tummy tuck, and especially patients who travel from the region outside the country, they come all the way for male tummy tuck. And some of them is just facial rejuvenation procedure, either non-surgical, using Botox and fillers, or using fat to make the face look better. So as much as we don't talk, men don't talk about what they do or the services they seek, I can confirm that we have a number of Kenya men who have done plastic surgery. The next misconception is around recovery period. You find people say that recovery period is intense, it's pathetic. Someone feels like you've been run over by a truck. What I would say to that is it depends with the technology that was used. A good example is when you do liposuction, or either liposuction the other procedure like tummy tuck. Whatever technology that is going to be employed in doing the procedure is going to determine your recovery. If you do, let's say, manual liposuction, then it's going to be very painful. If you do other liposuction that cause burn, skin burn, then you're going to have pain. But if what we use at AJ Plastic Surgery is semi-automated, is power lipo, and that has less trauma. The less trauma gives a quick recovery, cuts down on operating time, and overall gives you overall good outcome. The next is about all cosmetic surgeons are plastic surgeons. A bit controversial for me to comment, but just for the sake of safe surgery, that all plastic surgeons in this country are registered by the Kenya Medical Practitioner and Dentist Council and are members of the Kenya Society of Plastic, Reconstructive and Aesthetic Surgeons. So if you are in doubt whether the person giving you care is a plastic surgeon or not, you just either ask them for their number, board number, or visit the website for either the council or the council and the society, where we've listed all the certified plastic surgeons in the country. The next misconception is about plastic surgery. Does it last forever? Do we need touch-up down the line, or do we need the redos? My response to that is that the plastic surgery has very many procedures in it, and it's very difficult to put it in one box and say this is going to be permanent or not. So there are procedures that are one-off, and there are procedures that if you do down the line, because of environmental changes, you will be forced to do a redo or a touch-up. And I think this specifically question requires more time, and I promise to do in one of the episodes, just delve into what happens after plastic surgery. What is the lifeline? How is the aging? What do you do or not do to maintain the outcome that you've received after plastic surgery? The next one is more of a point of information, and also a very common question that we get during consultations, and what are the risks? And I think it's very important before you do any procedure to have that discussion, so that they do risk-benefit analysis. So what are the risks when you do plastic surgery? And how I'll answer this is that plastic surgery is like any other surgery. With that, you have complications that can arise either from the surgery itself, which are known, or from the anesthesia, if you're going to use general anesthesia. And every individual is different. You can have underlying medical condition, you can be on different drugs that will react, you can be having personal allergies to either food or drugs. You can have predisposition to certain adverse reaction. So that is why a consultation with a qualified registered plastic surgeon is very important as you embark on your journey to do any plastic surgery. That first day is what is going to minimize your risk. And then, of course, when you go into a center that have protocols that they do follow during those procedures, then you make safe surgery. Because we cannot emphasize enough the importance of being ahead of the risk and anticipating the risk and complication in any plastic surgery procedure. The last misconception that I'll tackle today is on the availability of service. You have a lot of inquiries. Question is, do we have plastic surgery services in this country, in Kenya, in Africa in general? My answer to that is emphatic yes. We have plastic surgery services, and at AJ Plastic Surgery Center, we do an array of plastic surgery services. They're available here, and we have a competent team of surgeons, doctors, and nurses to handle plastic surgery. And just to add to that is that medicine in general is local. It means you have different, due to our culture, we have different way the way we view people. And for plastic surgery is even more important because there's a way that African people of African descent of Africans would want their body to be, or do want, expect their body to be. So you'll be in a better hand if you have your procedure, especially for a cosmetic or a aesthetic procedure, like let's say BBL or lipo, by a person who understands your body, who understands your culture, and it is able to give you what is almost as natural to what would conform to your culture. That being said, I'm glad that we are having more and more positive news around plastic surgery. We have more acceptance, less stigma, and I think it's exciting. Maybe in the next 3 or 5 years, plastic surgery visit will just be like a dental visit. Sadly, this bit of misconception brings the end to this Plastic Surgery 101 session. Be sure I'll be back with many such sessions. I'll be willing to answer your questions. And if you have any query, question, misconception, comment, kindly send it to us through our social media platform on your screen, or use the number scrolling on your screen, and we are open to have this conversation. At AJ Plastic Surgery, we're the home of plastic surgery. It has been a pleasure having you. I've had a lot of fun. This is AJ Plastic Surgery TV, the home of plastic surgery, and Dr. Martin Ajujo. Stay tuned.